Today's Supreme Court ruling to uphold Obamacare will force Americans to buy health insurance. But what will it mean for your doctor, and will the law interfere with the treatments you receive? Let's ask Dr. Sreedhar Potarazu, CEO of Vital Spring Technologies. Dr. P, I want to start with the impact on me. I'm obsessed with the consumer impact here. Will my costs go down? Will my care improve?
The costs are not going to go down, Jerry. You know, we put a new label on this mandate, called it a tax, but premiums have already gone up by about $2,000 just since the law was passed. We've done nothing to help consumers, businesses get greater purchasing power to negotiate with insurance companies to bring that premium down. We've in fact empowered them more to game the system. So we really created no mechanism to bring costs down. There's this notion that, we're going to try and improve the quality and efficiency of care, which is important. But the thing that's never mentioned is that to really get to a point where we can measure quality and start creating a competitive market, well, that costs a lot of money. And it costs more money than the current price tag. So the president's statement today that you can still keep your coverage, that you can still keep your doctors, that is a flawed statement, and it's an incomplete sentence, because what he doesn't say is at what cost to you, the consumer, you will be able to do that.
Right. Well, we've only seen costs go up, and certainly this is going to be a very expensive law over the long term. One of the things I'm concerned about is the patient's relationship with their own doctor. Does this improve that? Does it mean I'll see my doctor more? Will I have more access to my doctor?
Well, you can certainly hope to see your doctor more, because the access is a misnomer in the sense that just because we're providing everybody with coverage, that doesn't become a proxy for care. Imagine if I said that everybody is going to get automobile insurance automatically, but there's a $1,000 deductible. Well, what if you don't have the $1,000? Then it really becomes meaningless. So we've always got into this routine that coverage is equivalent to getting care, and that's simply not true. Just because you have an insurance policy, if it's not the right insurance policy, well, then you won't get the care that you need. You won't be able to access the doctor when you need them to. And the insurance companies are certainly not going to be foolish enough to continue to incur losses if that trend continues.
Dr. P, though, what will be the impact on doctors? I mean, are they going to have more flexibility, less flexibility? Are they going to be forced to team up with big companies and become simply employees rather than sole practitioners?
That's already happening. Take the example of a major announcement this week that Aetna made in the Washington, D.C. area with a major healthcare system, with the Nova healthcare system, where the insurance carrier and the hospital are joining forces. So what you said is exactly right. The doctors start to become employees of the healthcare system. It starts to become a lot more controlled. There's a lot less flexibility in terms of what doctors can do. So you get back, in some respects, to the days of managed care. We probably even go further than that, because when these insurance companies start to align themselves with major hospital systems, what happens? You reduce competition because you have less number of entities competing. And when you have less competition, prices go up. It's economics 101.
Well, we've got a lot to look forward to, I guess, Dr. P. Thanks for coming on tonight, and thanks for describing what really will happen to consumers. Appreciate your time.
Thank you very much.